yet? Oh, you're so
We
soft.
are here at Hemo-Solutions for our first blood donation for Maggie. Hello. So what are we going to be doing today to our puppy?
We are going to put her white Adderall. Good girl, Maggie. Good girl. Good girl.
Oh, she loves her cookies. She's a little more squirmy because this is her first one, but she loves her cookies. She's giving kisses.
Good girl. Good girl.
Good girl. Good girl, Maggie. Good girl, you stay. Saddle. What a good girl. So what is our process? This is a quick, easy process you guys were telling me about.
We're just going to shave an area around her jugular.
Okay.
And she doesn't have much hair to begin with. So, mostly noise. Because we want the draw to be as aseptic as possible, meaning no bacteria around. So that's why we clip the hair, so we have a clean area to work. Good girl, Maggie.
Yeah, because when she came in to do her original blood test, she was fine. She just had to get used to being held like that, and then afterwards she was all tail wagging and happy, and it was fun. So the process usually takes a few minutes.
About 15 minutes altogether.
Excellent.
We'll take vitals. We'll take a temperature, a heart rate, respiration rate. We'll look at her gum color. And if there's anything that's not within parameters, then we won't draw. We'll send you to your regular vet.
Perfect. And so we did an initial blood test to make sure she was healthy before doing this. That was a quick little trip. And who does this blood go to benefit? Who is this? Where is this going? Why is this important?
Any animal that would need a transfusion. So for the same reasons that people need transfusions are the same reasons that dogs need transfusions. There are situations such as immune-mediated diseases where the body destroys the animal's own red blood cells. So a transfusion will get them through that crisis until the medications and treatments can start working. Or they have cancer and tumors will rupture, causing blood loss, hit by cars, anything that could cause a potential blood loss.
So the advancements in pet medicine, is there kind of a greater need that you've seen for blood? Because this is really something new to me. I didn't ever even thought about, blood banks for pets, even though I knew there was still surgeries and stuff.
I think it's more of a combination of people more aware and people recognizing their pets as companions and not just animals, if that makes any sense.
No, it does. There's all the statistics show that this is how we treat our pets is just getting more and more close to how we treat ourselves. So,
And so I don't know if you can see that.
So is there a big? Oh yeah. So is there a real need for this out there?
Oh, absolutely. We can't keep up with the demand. We ship blood all over the country, and it's not unusual to have a wait list these days.
Wow.
And there's probably 8 national or commercial blood banks in the U.S., and then there's a lot of smaller private blood banks that people have their own blood bank just for their own facility. Like universities or specialty practices may have their own blood bank based off of their employees' pets.
That's excellent. So we need more. And what are the qualifications for a pet donor? What makes a healthy donor dog?
They have to be between the ages of 1 and 8. They have to be at least 50 pounds. They have to be current on all their vaccinations. They have to be easy to handle because they do have to lay still for 8 to 10 minutes while we pull the blood. And they have to be on heartworm preventative from April until October. And we will pull all the blood work at no cost to the client, and we also screen for 8 different bloodborne parasites. That won't cost the client anything. The only way it would cost them anything is if we accidentally found something wrong, like a thyroid issue or a blood parasite, and then we don't require you to treat it, but if you want to be in the program, you do have to treat. And that is between you and your vet how you go about treating it. So that information is always shared with your regular vet.
And you guys do something a little bit special for your donor families to even help out with keeping those dogs healthy. What is that?
We give them money.
Specifically to the veterinarian, right? Correct?
Yeah.
To make sure they're up on the...
After 6 successful donations, we will send anywhere from $75 to $150, depending on what blood type they are, to their regular vet to be used for heartworm preventative, routine blood work, special diet, emergency, whatever you want to use it for. That ensures that the client is always going back to see their regular vet.
That's a great thing to do. And so how many donations a year do you guys request from a donor?
6.
Oh, that's not bad at all.
So that averages out to about every other month.
Oh yeah, about 15 minutes plus the drive to do this. I like it. See, do we got a happy Maggie? Yeah. We got a happy Maggie. Are you still our friend? Do we got cookies?
Right over there.
And that is the part I worried about as a parent, is whether or not she would be upset or in pain, and she's just fine. You're gonna go get a nap, aren't you? And cookies.
We're gonna make her lay still for just a little while we apply pressure to her neck.
Okay.
Because we want to make sure that a nice little clot forms. And then we ask that she had just a few restrictions for the next couple hours, like no pulling on her dog chain. If she goes out to the restroom, don't let her yank on the leash, because we don't want to break that clot.
You're a happy baby. Well, we got a happy baby and a successful donation. Hopefully you can help some puppies. And thank you to our friends at Hemo-Solutions.